You're watching CTOM TV. Knowledge is power.
Marla wants to know, what is the difference between a normal blood test for cancer and a liquid biopsy for cancer?
Okay. What is a normal blood test?
I think, like PSA, white
PSA
cell.
is for prostate
white
cancer.
Cell. Well, help me out here. You're the expert.
CEA. Let's go with CEA, carcinoma embryonic antigen.
Because, I hear about people saying, I went to my GP, wasn't feeling well. They did a blood test and my white blood cells were up or some such thing, which is probably what's being referred to here.
Right, yeah. Well, there are cancer markers, CD, the CDs, CD19, CEA. And these are typically markers of stem cell, early stem cells. And when they go up, that means you have a lot of stem cell activity, and cancer is a disease of the stem cells. So that's indicative that you have a cancer. It can also be indicative of many other things. So they're not very accurate.
What else could it indicate? Just
inflammation.
Inflammation.
Your body's repairing tissue, you're growing, there's all kinds of things that it can do.
that aren't necessarily threatening at all.
No, but they're the same process that cancers use too.
Okay.
So they're the healthy versions of the process. So it can be very misleading. And these blood tests can be high in patients that have low tumor burden, and they can be non-existent in patients that are, heavily treated in stage 4.
So they're not very indicative.
They're not very indicative. And, you can't put a lot of emphasis on them. Liquid biopsies, on the other hand, identify a mutation that is unique to you and is driving your cancer. And then we look for the level of that in the blood. So it's incredibly accurate, and it's a wonderful way of determining whether your cancer is in a metastatic process or not.
I know that in science, we're not allowed, you're not allowed to say 100%. So what we see in studies using certain 99.98%, it's, they're just leaving that little room, but highly accurate.
And we can detect minute amounts with digital PCR now, chip-based digital PCR that we use. We can detect it down to 0.001. That's just a small fragment of DNA in your blood.
Yeah, and what he's talking about detecting is the mutation in your body that's driving your cancer.
Yes.
So we can see how much of that mutation there is, and therefore how well your cancer is working, or if your cancer is truly gone.
Exactly.
Yeah.
Yes.
Thank you for watching CTOM TV. Subscribe below and stay informed.